Hi everyone! I hope all of you are healthy and well. In this video, we will look at some of the basic facts and misconceptions of the coronavirus. There's a lot of fear, doubt, and uncertainty currently surrounding this virus. In this video, I hope to clear some of those doubts and give you a clearer understanding of what this virus is all about. So first, we will be looking at what the coronavirus is generally. Most of you might already know this, but I want to give a brief introduction for those that don't. The first question is what a coronavirus, not just COVID-19, but the family of coronaviruses, are. This quote is from the National Institute of Allergy and Infectious Diseases, and it summarizes what the family of coronaviruses are characterized by. They say that coronaviruses are a large family of viruses that usually cause mild to moderate upper respiratory tract illnesses, like the common cold in people. However, 3 times in the 21st century, coronavirus outbreaks have emerged from animal reservoirs to cause severe disease and global transmission concerns. So this is what the family of coronaviruses are characterized by, and we can see a lot of similarities to the current situation that we are facing. Now that we've established what the coronaviruses as a family are all about, now we will look at the distinguishing factors of COVID-19. The incubation period of COVID-19 is 14 days. This means that for 14 days, individuals can be infected but not show symptoms. This is so dangerous because for those 14 days, you could have the virus but spread it to the people you come in contact with and not even know. That's why, even if you don't show symptoms, you should steer clear of others so that you don't spread it. Some people will be infected and never show symptoms. This can also be dangerous because you could spread it to people in the risk group, which we'll be talking about later. The virus spreads through respiratory droplets. This means that if you cough on someone or a surface and someone comes in contact with that surface, you could easily infect them. The virus originated in Wuhan, China. And a really good way to describe the coronavirus is not a flu or the cold like many people say, but as a viral, highly contagious pneumonia. The current hotspots in the world for the coronavirus are the United States, Italy, and Spain. The United States currently has 190,000 cases, Italy 100,000 cases, and Spain closely following, also in the 100,000 range. All of these numbers are as of April 1st. The second series of numbers that I have there are the number of cases per 1 million people in each country. In the United States, there's around 580 cases per 1 million people. In Italy, there's around 1,600 per 1 million people. And in Spain, there's around 2,000 cases per 1 million people. This is why looking at the complete whole number is very misleading, because it doesn't take into account how large the actual country is, but the number of cases per 1 million people puts it in perspective. Some people claim that everyone is overreacting about this virus and it's just like other diseases we've seen. One comparison that people often make is H1N1, or the swine flu. The differences between this 2009 pandemic and the current COVID-19 is that H1N1 was more understood because it's similar to influenza, because we understood the flu and H1N1 is so similar, we were able to understand and create a vaccine quicker than we are able to now. Also, around 1/3 of individuals over 60 already had antibodies against the H1N1 virus, and people speculate that this is probably because of exposure to older H1N1 viruses sometime in their lives. This protects some of the community against this virus, especially in the elderly population. In the current coronavirus, individuals over 60 have the highest mortality rate and the highest risk. And if we look at the mortality rate between H1N1 and the coronavirus, the mortality rate of H1N1 is approximately 0.005%, and the coronavirus is close to 1%, which is significantly higher. So now that we've established the basics and significance of the novel coronavirus, let's look at ways we can protect ourselves and others. Common symptoms of the virus are fever, coughing, and shortness of breath. The vulnerable groups for the coronavirus are individuals over 60 and individuals with compromised immune systems. A huge misconception is that if you don't fall in this group, you don't have to be careful and follow the recommendations. This is completely untrue, and we will talk more about the reasons why. But in short, even if you don't fall in the risk group, you could infect other people that are, so you should be considerate of those that are in these risk groups. And even if you are young and healthy, you could spread it to those that aren't. A term that we hear often nowadays is flattening the curve. So, I'm going to go over what this actually means. So, flattening the curve refers to if we use protective measures to control the spread of the virus. So social distancing and all the other recommendations, stay 6 feet away from people, all these other recommendations that people are making, this is to flatten this curve. If we did none of this, the amount of cases would spike dramatically and then spike downwards. But then the healthcare system won't be able to treat as many people as they can if we slow it down and spread it out. There's only so many beds, ventilators, and healthcare professionals that are there to ensure proper care for people that are infected. If we don't take protective measures, we could overwhelm the healthcare system like we saw in Italy. So the best thing to do is to follow recommendations made by professionals, stay home, and stay 6 feet away from people if you have to go outside. So one of the recommendations that a lot of experts make is social distancing. According to Johns Hopkins Medicine, social distancing is deliberately increasing the physical space between people to avoid spreading illness. Staying at least 6 feet away from other people lessens your chances of catching COVID-19. So these are general ways to protect yourself and others. You should wash your hands often, avoid touching your face, especially when you leave the house, sanitize frequently used surfaces, and a rule of thumb is to always act as if you and the people around you have the virus. So what I mean is don't go like crazy when you go outside of the house, but it's just to maintain a safe distance so that you don't infect others and that people don't infect you. So because of the panic that comes with this virus, there is a lot of common myths that have been spreading and rumors that I will dispel in the next few minutes. So one common assumption is that if you wear a mask, you won't get the virus. Masks are a protective measure and can keep you safe, but they won't. It's not 100%. It's not 100% effective in making sure that you don't get the virus. So although it is a protective measure and there's no harm in using a mask, it's not if you wear a mask, you won't get the virus. That's not how it works. And another reason why people are discouraging buying masks is that at this time it's better not to, because healthcare workers need masks, and people that are infected or caring for someone who's infected, they need masks much more than if you don't. For you, it's better to follow the general guidelines of staying 6 feet away from people, staying at home, and those kind of things, instead of buying a mask and taking it away from someone that needs it more than you do. Another myth is that if you're not asymptomatic, you won't spread the virus. And this is not true. The most dangerous thing is that you could have the virus and not have symptoms. And this is fine for the infected individuals, meaning they don't feel anything, but if they come into contact with others, other people could be infected. So even if you don't show symptoms, you should be careful. Another myth that I mentioned earlier is that if you are young, you don't have to be careful. The coronavirus is a nasty virus, as many people that recover from the virus have claimed. So, first of all, you don't want to get sick. That's the main reason why you should be careful. And also, if you are young and healthy, you're not at risk of dying for the virus. That's what everyone's saying, but it is a very uncomfortable infection. And you could spread it to your loved ones and other people. That's another reason why you should be careful. And if you're young and have underlying health condition, that puts you in the risk group. So that's even more of a reason to be careful. A rumor or an assumption is that everyone who gets COVID-19 will die. The mortality rate is around 1%. So you can very well get the virus and still survive. However, if you are in the risk group, so those that are older and have underlying health conditions, the chances of mortality are higher than 1%. People around the web have been claiming that they found a cure or there's a vaccine for the virus. Possible drugs are being tested that might seem promising, but there's no concrete evidence that these drugs or others will work. And the development of a vaccine is in process, but as of late, there is no vaccine. Another common myth is that the virus will die out when the temperatures get warmer. So maybe it's not correct to call it a myth, but it's more of an assumption or an unfounded claim. Because summer has not come, we don't know if the virus will die out when temperatures get warmer. Some viruses that we've seen do, but we have not experienced it for this one. So there is a chance that it could die out. So this doesn't mean that it will for sure not die out when the temperature gets warmer. It's just not something that we should rely on. A contradiction to this, that the virus will die out when temperatures get warmer, is that individuals in warmer climates have also been infected by COVID-19. So this goes against the fact that if temperatures get warmer, it'll go away. So the only way we could really know is by waiting for the summer to come around and seeing what happens. Another common rumor is that the coronavirus was created in a laboratory, but there is absolutely no evidence to back this up. Studies have actually shown that this virus is a natural product of evolution. This means that there's a lot of evidence to claim that it's not man-made, and there's absolutely no evidence to claim that it is man-made. And another thing is that this isn't one of our biggest concerns at the moment. The concern is how to save lives and stop the spread of the virus, not if this was created by someone. That's something we can figure out once we control the spread. Another thing that's been floating around the internet is that Advil makes the virus much worse. So this has not been tested, so we can't be sure. Some sources claim that Advil does make it worse, but it could be merely a correlation rather than a causation. Because people in the risk group, elderly and people with underlying conditions, they might be more likely to take Advil, and therefore they will have a worse reaction to the virus, but this could just be because they're in the risk group, not because they took the Advil. So there could be a correlation between that, but that doesn't mean that it's a causation. That doesn't mean that the Advil makes the virus work. So because of this, it's not something to be totally scared about, but if this is something that you want to look out for, that's totally fine. You can avoid taking Advil and other ibuprofen and anti-inflammatories, but just know that there isn't complete evidence to back this up. So not only are there a lot of myths circulating, but people are believing a lot of sites that are not true and are accurate. Because of this, I've compiled a list of reliable and useful sources to use to clear the air and prevent the spread of misinformation. I'll put this in the description box so you can refer to it after the video. So now I just want to say a huge thank you to everyone out there that is helping all of us in all different sorts of ways. We appreciate you more than words to describe and are thinking of you each and every day. I hope that you and your family stay safe and healthy throughout this crisis. So thank you everyone for watching this video. I know the situation is incredibly frustrating, especially because we don't know when it'll end and all the other imaginable things everyone is going through. But hang in there and comment below how you're coping up with the new environment and how much you have been affected. If you have any questions, don't be afraid to comment and I'll try to answer to the best of my ability. Also be sure to check out my channel for science experiment videos for your kids to do during this quarantine. And be sure to subscribe to my channel, Powerlearn. Thank you all and stay safe.